Hi everyone, my name is Andrew Jeffress and I serve as the Media Coordinator at the Alliance for Innovation Infrastructure, AII, the only nationwide public policy think tank dedicated to infrastructure. The month of August is Energy Month, where we shine a spotlight on the critical importance of energy resources. But energy is not just about electricity. It fuels transportation, heats our homes, powers industries, and drives innovation in fields like healthcare and technology. Today I have the distinct pleasure of speaking with Diana M. Weber, MD, Chief Clinical Operations Officer at Livingston Healthcare. Consumers are just as important as those who work behind the scenes to make modern life possible. And Diana certainly has a wide range of experience in the medical field to talk about just how critical energy infrastructure is in her line of work. It's fantastic to be with you here today, Diana. Thank you so much for joining the conversation to share your perspective.
You're welcome, my pleasure.
To begin, I would love for you to talk about your career path and the responsibilities in your current role.
I am a general surgeon and I practiced surgery for about 17 years and got more and more involved in the administrative side of medicine. And so for the past 5 years or so, I have been focusing on working on the administrative side of medicine, and I'm currently the Chief Clinical Operations Officer at Livingston Healthcare. And I took this job because it was a combination of being the Chief Medical Officer and working with physicians, as well as the Chief Operating Officer, and working on how we can improve our operations and make the hospital and clinic a safer place for our patients.
How critical is reliable energy supply to the operation of medical equipment in your practice? Can you give me some examples of equipment that directly depends on a stable energy source?
It is crucial. Everything we do is connected to an energy source. We had a power outage 6 months ago or so, and while we have generators that are really powerful and can pick up almost everything, not everything is connected to the generator, and we quickly saw where our weaknesses were. The lights went off initially, but then, in a lot of places they turned back on, but there were some areas that were critically underpowered, and it really put patients at risk by not having a source of energy to do the work that needed to be done. We can't run the whole hospital. We can't do everything. We have to prioritize what we can do on a backup generator. So we absolutely have to, for daily operations, we need to have a consistent energy supply. We had a number of patients in our infusion center getting infusions of things like chemotherapy and immunotherapy, and there was no power in that room. So initially, because there were windows, they could do fine with natural light, so there was no lights. And they have computer on wheels that could work on battery power for a while, but the battery started to go dead. They also had IV pumps that initially were on battery power, the pumps that are pumping the infusions into the patients, and those started to go down. Communications were interrupted. It was really a terrible situation. You can't just stop these infusions, and we weren't in a position to be able to move those patients. So it was an eye-opening experience of what happens when we don't have power to that part of the building.
Say for instance the power goes out. How long would a generator be able to supply energy to the hospital?
Our generators at Livingston Hospital would work for about 5 days. They're diesel powered, so we would need to refill the tank after 5 days. The main issue is that not everything is connected to generator power. We don't have the capability to plug everything in. And so while we could continue to do most work, there are some critical things that we wouldn't be able to do. For example, something else I learned very recently is that an MRI machine requires helium to be circulated as a chiller to keep the magnet cool. And there's an electrical compressor that keeps the helium circulating. And when that goes down, helium outgasses, and eventually it can't keep the magnet cool, and the magnet will shut down. And that's about $100,000 to refill that helium. And you might destroy the magnet as well. So you absolutely have to keep that MRI plugged in. And it turns out that our MRI wasn't connected to the generator power. And so while nothing happened, because it was a pretty short power outage, that is a huge risk. So that kind of machinery just can't function. Another time in another hospital, there was a power outage, and unfortunately the backup generators also failed. And it was only in certain parts of the office building, but it was an area where there were thousands of dollars worth of medications in refrigerators that had to stay cool. And these medications, we were at risk of losing thousands of dollars worth of medication because of this power outage and a lack of a generator backup. It was an epic fail. People were, working tirelessly to try to get these medications into other refrigerators. But that kind of thing is just, it's not something you expect to experience. You don't expect the power to go out and the generators to fail. And that happened in this scenario. In a large hospital where you would hope that kind of thing wouldn't happen.
One thing that I would love for you to go into detail about is, as a surgeon, what kind of technologies are you using that require a substantial amount of energy? What do these technologies look like? What are you using patient to patient that absolutely requires energy infrastructure to be working?
Almost everything in the operating room is connected to energy. So first of all, you have a patient that's asleep on a ventilator, a breathing machine. That's obviously requires energy. All of the equipment we use, things like cautery to stop bleeding, just getting the bed up and down and getting the patient positioned properly requires energy. Obviously the computers that people are using to document and to order medications, even the dispensing of the medication comes out of a machine that requires energy. So I was working a long time ago at a hospital in Kenya, and I was in the operating room and the power went out, and thankfully it had windows so I could still see, but it was one of those just crazy experiences where suddenly there was no energy. The generator backup did turn on and we were able to continue, but it just makes you look around and see how much you rely on things working, and when they stop working, your heart stops as well. I think of things like heart surgery, where the patient is literally, their heart is their blood is going through a pump outside their body. That of course requires energy. Or orthopedic surgery, where you're using saws and drills that require energy. And again, just keeping the patient alive on the ventilator. What you could do is you could bag the patient by hand and get through for a period of time. Eventually that would get pretty tiring, but that is possible. And there are a lot of things you can do to mitigate the sudden loss of energy. But it is definitely, there are some things that you can't manually do. So you would require backup energy of some sort. So you need an absolutely reliable backup source of energy if you're going to be working in a situation like that where you can't keep going without an energy source.
One of the things that came to mind as you were talking were life support machines. What would it look like if we didn't have the energy infrastructure to support those? How long would a patient be able to survive on a generator?
In all hospitals, there are special outlets that are connected to the generator. So you want to make sure that all your crucial equipment is connected to those outlets. They're called red outlets because they're red. And you plug in, you want to make sure your ventilator, your suction, probably the bed itself, since there's so much you need to do with moving the bed with the patient on it. All of those things need to be plugged into those outlets. And you need to, again, make sure your generator is functioning and has the fuel to keep going.
Where do you think medical advancements would be without the energy to support our innovative technologies?
That is a really difficult question to answer. When you think about some of the stuff that we use that's been around for centuries, like obviously a lot of that was invented without energy, but everything, coming up with a new medication requires very precise measurements, weights, weighing substances. There's just not much you could do without that infrastructure. Microscopes, centrifuges. I mean, I just can't even think of all the things that you need in order to do things like, coming up with new medications. I don't know where we would be without the energy to drive these technologies.
What would you like policymakers and decision makers to know?
What we really need to realize as a community is that everything we do is dependent on having a reliable source of energy. And as we see, as we have fears of not having enough energy, we would have to decide how to prioritize where that energy needs to go in order to keep people alive. I think the most important thing for policymakers to recognize is that the amount of energy we have can't be dependent on one source. We can't say, as much as we would like to use all renewable energy, it might not be enough to supply the needs that we have as a nation. And so I think of this as it's not an either or, it's an and. We need to investigate alternative sources of energy at the same time realizing that right now we need to be really cognizant that we are completely dependent on the types of energy that we currently have. And I am very supportive of trying to minimize our impact on our planet, and yet we have become very dependent on having a reliable, consistent source of energy in order to take care of patients and provide the kind of healthcare people need.
Going back a little bit, I would love for you to go into detail about the technologies that you learned to use when you entered the medical field and how those have evolved over time. How much energy do those require, and how much more energy has been required since?
When I trained and in my early years of practice, everything was on paper. We had paper charts, and now we're all in the electronic medical record. When we have power outages or failures of our EMR, we have to go back to paper. And a lot of people don't remember how to do that. And so it slows everything down. That's a huge way that our delivery of healthcare has changed in the time that I've been practicing. The biggest thing is that everything's on the computer, and instead of looking for a chart, I mean, the nurses would chart in a paper chart, and we could see their work. And now it is all on a computer. And if we can't use the computer, we can't see everybody else's work. So it has changed dramatically. Everything I did as a surgeon, by the time I finished my practice, was completely different from the way I did it when I was first starting out, in terms of energy sources used in the operating room, in terms of the way we treated patients with things like radiation therapy, to less toxic forms of chemotherapy, all developed, over years because of people having the resources they needed to do that kind of experimentation, which definitely could not have been done without energy sources.
Given that our energy infrastructure is so critical to daily life, especially in the medical world, how do you think our approach would change when it comes to educating medical students?
I think it's scary to think how dependent we are on energy. It actually is frightening. When I was thinking about this over the past couple days, like what would be like if we suddenly, our power grid failed and we just had to live off of the generators that we have. How long could we really do that? What would we have to eliminate? Gosh, that is a great question, and I'm not even sure how to answer that. The way I teach people would be the same in terms of how the body works and how to do a surgical procedure and how to treat a patient, how to interact with a patient. I mean, that doesn't require energy. I can have a conversation and take a history and do a physical exam in a room with natural lighting and a pencil and a piece of paper. So I could still do that. I could tell somebody how to do an operation. I could explain why we do things the way we do. I could talk about, the epidemiology of this type of cancer and why this person might have gotten it. I can teach the patient about their disease. I can tell them how I'm going to treat them. All of that I can do without energy.